Don't ever settle for a training post that's not what's going to really drive you, because you're going to be doing this for the rest of your life. You've got to treat this exam, this interview to get onto the training program, like the most important exam in your whole career. Because if you don't do it and you don't practice for it and prepare for it, then you can't do any of the other exams. You can't do the fellowship exam if you don't get on the training program. Don't get a huge mortgage, because it'll be hanging over your head, and even if it subconsciously alters what you do or why you do it, it's a terrible outcome to have, and a terrible thing to have sort of looming over you. I think sometimes here in Australia, we, the most famous surgeons here are the sort of surgeons that operate on the sports people, whereas in Canada and America, the most famous surgeons there are the ones that are the most well published. And I think realistically, being a published surgeon and doing good research changes practice globally, whereas being really slick technically changes people's outcomes very locally. And I sort of saw in my training that often surgeons that were doing regular Saturday lists and the like, hey, we're not still married to the first person they got married to, and I reckon that just seemed to me a recipe for disaster. So I'm actively mindful of not working, longer than normal, getting home at a time when I can still be, an active member of the family. It's really important to treat everybody equally, and so that ranges from the staff you work with and the ancillary staff, as well as the patients you see. And if you're fair and even and listen to everybody, then I think it really helps the whole process move forward.